Hey there everyone. In the previous video of medial side of the thigh, we had studied the obturator nerve, the obturator artery, the medial circumflex artery and its branches, relations and other things. In today's video, we are going to study the clinical anatomy of the medial side of the thigh. And this video is going to be a last video on this medial side of the thigh as the chapter is about to be completed. So in this video, the clinical anatomy of the complete chapter is covered. So we are going to see it one by one. So first one is the testing of the obturator muscles. How do we test the obturator muscle? Patient lies in the supine position. One limb is adducted. Okay, one limb it is taken to near his body, so it is adducted. One of the limb is adducted. Physician holds adducted limb with his right hand. The physician, whoever is checking or testing the adductor muscle, he is going to hold the adducted limb with his right hand, and subject is asked to move the limb medially against the resistance of the physician's hand, and physician feels the adductor muscles in his left hand. Okay, so this is about the testing of the adductors. Okay, now we're going to see spasm of the adductor muscles. So it is called as the spastic paralgic. Okay, paralgia, or this is paralgia. Okay, the spastic paralgia, it causes pain, and surgical division of the obturator is nerve to give pain relief. Okay, to provide pain relief. So this spasm of the adductor muscles, this particular condition is called as the spastic paralgia. How do you remember it? See, S for spasm and S for spastic. Okay, so the paralgia refers to the pain. Okay, so pain, pain is seen, and the surgical divisions of the obturator nerve is done to relieve the pain. So this is called as the spastic paralgia. The condition of the pain of the adductor muscle due to the spasm is called the spastic paralgia. Now we are going to see a disease or injury in the hip joint. Okay, if there is some disease or injury in the hip joint, may also cause in the knee joint. Okay, it can travel to the knee joint, to the medial side of the thigh from the hip joint to the common peroneal nerve, because there is common peroneal nerve, and obturator nerve can be injured as well, which supplies the medial side of the thigh. So if there is any injury or disease or infection in the hip joint, it can travel to the knee joint and affect the common peroneal, because there is common nerve supply. Okay, so common nerve supply, so the obturator nerve can be injured as well. So in retroperitoneal syndromes, okay, the retroperitoneal space is present. So if there is some retroperitoneal syndrome, the obturator nerve involved with the femoral nerve. Okay, the obturator nerve, it is involved with the femoral nerve as well, as they arise from the same root, that is L2, L3, L4. The dorsal side is the femoral nerve and the ventral side is the obturator nerve. They are arising from the same root value, so it is involved with the femoral nerve, so causes nerve entrapment syndrome. Okay, it causes nerve entrapment syndrome. What do you mean by entrapment? Nothing but trapping of that nerve is called as entrapment. See, trapping of the nerve is called entrapment, which causes chronic pain on the medial side of the thigh. It occurs in athletes because their muscles are big, right? They have got big muscles due to working on the muscles, so the muscle fibers tear, and when they take high protein intake, so all the protein and other things, they go and repair the muscle. Instead of one broken or torn muscle strand, they make double of it, so that is the reason they have bigger muscles, and due to the bigger muscles there can be entrapment of the nerve, which causes chronic pain on the medial side of the thigh, which is seen in the athletes because they have the bigger muscles. So this is due to the nerve, this is the nerve entrapment syndrome. Okay, it causes nerve entrapment syndrome because they arise from the same root. Which one? The obturator nerve and the femoral nerve. From the L2, L3, L4 on the dorsal we have the femoral, on the ventral we have the On the ventral we have the obturator, on the dorsal we have the femoral. So both of these together, when they get involved and entrapped, the nerve entrapment occurs. It is called as a nerve entrapment syndrome, causes chronic pain in the medial side of the thigh. It is mostly seen in the athletes because they have bigger adductor muscles. Okay, so this ends the complete clinical anatomy of the medial side of the thigh. We have successfully completed 2 chapters, that is the front of the thigh and the medial of the thigh, completely in detail. So the next video for anatomy will be on the gluteal region, and for physiology we are going to start the nerve and muscle physiology. Thank you so much.